This module, Assessing and Diagnosing Substance Use and Related Disorders, is part of the Impacts project of Youngstown State University, supported by the Health Resources and Services Administration, the U.S. Department of Health and Human Services. There are evidence-based screening tools that are used to determine whether an individual is at risk of misusing substances. These screenings are used to give clinicians a sense of where clients might be at risk, but they cannot be used to diagnose without additional assessment or screening tools. The first and simplest tool to use is called the CAGE. The C stands for cutback, the A, annoyed, G, guilty, and E, eye-opener. Essentially, you'll ask the client whether he or she has ever tried to cut back, thought about cut back, or unsuccessfully tried to cut back on use, whether others are annoyed with his or her substance use, whether he or she feels guilty after using, and whether he or she ever needs an eye-opener first thing in the morning to get started with the day. Full screen information is available at the web link provided. Another screening tool similar to the CAGE is used with adolescents, and this is called the CRAFT. Again, each of these letters stands for one letter in the assessment. This assessment determines whether an individual has ridden in a car with someone under the influence, used a substance to relax, used alone, whether family or friends have advised cutting down, whether the client has gotten into trouble when using, and again, the full screen is available at the web link provided. The NIDA screening tool is available for alcohol and other drug use risks, and the full screen is available at the link provided. The Alcohol Use Disorders Identification Test is a free assessment that can be used in paper, pencil, or interview form. It measures the frequency, quantity, and consequences of alcohol use to include hazardous use. This full screen is available along with a manual for use at the link provided. The Drug Abuse Screening Tool, or DAS, serves the same function as that audit does for alcohol use. It assesses risk related to drug use, and there is a 10-item screen, full item screen, and A for adolescents available at the links provided. In addition to these screening tools, there's also the opioid risk tool, which is used to assess the risk of opioid abuse in clients who are prescribed opioids for pain relief. This is typically used by primary care providers, but can be a useful tool if you're working with clients who are receiving pain medications and you want to support their awareness of the risks of these medications. This screen is available at the web link provided. All of these assessments can be used to determine whether an individual might be misusing alcohol or other drugs. However, none of these alone can be used to provide a diagnosis. There are specialized assessment tools that can be used for this purpose. Targeted assessments focus on a specific domain or address specific client characteristics. The University of Rhode Island Change Assessment Scale, or Eureka, assesses motivation to change, including readiness, ambivalence, willingness to change, and also whether he or she is in pre-contemplation, contemplation, preparation, action, or maintenance. The Eureka is available at the following web address and is freely downloadable. The Substance Abuse Subtle Screening Inventory, or SASI, is a thorough assessment that measures both self-reported use of alcohol and other drugs, and also subtle attributes associated with high-risk substance use. It comes in adolescent and adult forms. However, the downfall of this assessment is that it requires practitioners who use it to be trained in how to use the assessment and score it, and the SASI itself is not freely available. The advantage to this assessment is that it can help with assessing and providing preliminary diagnoses related to substance use disorders with clients who are less than honest about their current use through information that they provide on the subtle assessment. There is a clinical opioid withdrawal scale, or COWS, which measures symptoms of opioid withdrawal. This assessment is available freely online and can be helpful to those clinicians who are practicing in outpatient settings or residential settings where opioid withdrawal might be experienced. This assessment is specifically for measuring the degree of opioid withdrawal symptoms and syndromes. Comprehensive assessments are typically administered via semi-structured or fully structured interviews, and this allows the clinician to develop a comprehensive clinical picture of the client and to formulate a diagnostic profile. These comprehensive assessments collect information from a wide range of mental health, biological, physiological health, substance use, and social history. The Addiction Severity Index is a semi-structured interview, and it measures functioning across the 7 domains, including medical conditions, employment, alcohol and other drug use, legal consequences, family history, relationships, and mental health disorders. You can find more information at the website provided, and you can also obtain forms for administering the ASI from this website as well. The structured clinical interview for DSM-5 is a semi-structured interview that's aligned directly with the DSM-5 criteria for substance use and related disorders. The advantage to this interview protocol is because it is aligned with the DSM-5 and lends itself to differential diagnoses and considering other diagnoses in the DSM-5, it is appropriate for use and very streamlined in terms of assessing and providing a diagnostic profile. The disadvantage to this is that it is not freely available. And so if you plan to use this assessment, you will be investing in the interview protocol. The World Health Organization's World Mental Health Composite International Diagnostic Interview is a fully structured interview that measures distress and impairment, severity of symptoms, course, additional diagnostic considerations and disorders, chronic conditions, disabilities, services, childhood experiences, and demographics. This assessment is very thorough, which is an advantage in terms of collecting information. At the same time, the thoroughness may be for practitioners who are learning how to use the assessment a bit unwieldy. There is more information at the web link provided, and I would recommend taking a look at all of these to see what different components are involved in these comprehensive assessments, and also to consider your agencies or your workplace sites' assessment protocols and how they fit with these evidence-based assessments. In terms of placement, the American Society of Addiction Medicine, or ASAM, has provided patient placement criteria based on levels of risk in 6 different dimensions. These dimensions include acute intoxication and/or withdrawal potential, which includes the past history of serious life-threatening withdrawal or current similar withdrawal symptoms. Biomedical conditions and complications, which includes any current severe health problems. Emotional, behavioral, cognitive conditions, which includes imminent danger of harm to self or others, and the inability or ability to complete activities of daily living. Readiness to change, which includes the ambivalent or denial of the need for treatment. Clients may be coerced, mandated, or required into assessment or treatment, which may decrease their readiness to change. Relapse, continued use, and continued problem potential, which could be a risk factor if clients are currently under the influence or their continued use or problems are imminently dangerous. And finally, recovery environment, where risks include immediate threats to safety, well-being, and sobriety. You'll find that these 6 domains align very nicely with the comprehensive assessments. And by assessing these 6 domains, including the client's strengths and areas of need, it's possible to formulate a profile that can inform placement decisions. The placement decisions that are available are, again, based on these 6 dimensions. You can see in this graphic the different areas that will be explored and how they relate to the potential concerns on the previous slide. In terms of placement, based upon the level of risk, the client's strengths and needs, he or she will be placed into one of 5 broad levels of care. Early intervention is indicated for clients with mild concerns or who are experimenting with substances and beginning to have consequences that don't meet diagnostic criteria. Outpatient services are appropriate when clients are at low risk, and intensive outpatient, partial hospitalization, intensive outpatient, and partial hospitalization are all appropriate when a client meets mild to moderate risks in most of the categories. Residential and inpatient services, medically managed intensive inpatient services, are most appropriate for clients who are at acute medical risk due to detox and withdrawal, physiological or psychological comorbidities, and/or risks associated with their use. Ideally, as clients progress through treatment, they will transition down into lower levels of care such that they're supported in maintaining their sobriety while also continuing to engage in treatment while they reintegrate back into their lives without the use of substances. This module was prepared for the Impacts Project at Youngstown State University. Again, this project was supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services. If you have questions or would like more information, please feel free to follow the links that are provided via the PowerPoints and to email the creator of this PowerPoint, Amy Williams, at aewilliams02@ysu.edu if you have questions. Thank you. We'll see you in the next module.